Welcome back to the Senior Strength Show. I'm your host, Arthur, and no, we're not talking about relationships today, or why your grandkids think your flip phone belongs in a museum. Today, we're getting real about something far more important than social media trends or dating after 60. We're talking about hygiene. Yes, hygiene, the unglamorous but absolutely life-saving stuff. Now, I know what you're thinking. Arthur, I've been washing myself just fine for over 6 decades. Why are we bringing this up now? Well, here's the truth. After 60, your body changes in ways that soap and water alone can't fix if you're not being intentional. Improper hygiene is one of the top reasons seniors end up with infections in the hospital or worse. And I don't mean, oops, I skipped a shower kind of thing. I mean real, serious risks that many folks just don't realize are tied to daily habits. If you're over 60 and still want to enjoy road trips, Sunday brunches, or spoiling the grandkids without a surprise trip to the ER, what we're about to share could be the most important 12 minutes of your day. We're breaking down 5 specific body parts that need special care each day, not just a quick splash and dash, to keep you healthy and infection-free. Joining me today is someone who knows a thing or two about keeping seniors strong and safe, Dr. Sarah Mitchell. She's a geriatrician, an infectious disease expert, and, fun fact, a karaoke champion at her local senior center. But we won't ask her to sing today. She spent over 20 years studying senior hygiene, and at 58 herself, she's seen firsthand how small changes can save lives. Dr. Mitchell, welcome to the show. Be honest with us. Why does hygiene become such a big deal after 60?
Thank you, Arthur. And yes, I promise not to break into song yet. You're absolutely right. After 60, our bodies don't bounce back like they used to. The skin gets thinner and more delicate, like grandma's china set, and our circulation slows down. The immune system? Let's just say it starts acting like it's on a part-time schedule. So when bacteria, viruses, or fungi sneak in, what would have been a mild rash at 30 can turn into a full-blown infection that requires hospitalization at 70. And I don't mean, oops, I skipped a shower kind of thing. I mean real, serious risks that many folks just don't realize are tied to daily habits.
All right, Dr. Mitchell. Before we go from head to toe, let's start at the bottom. I've heard you say before that feet tell the story of a senior's health. That sounds poetic, but also a little scary. Can you explain what makes foot hygiene so important after 60?
The first and most critical body part that seniors must wash daily is their feet. This might surprise people, but foot infections are one of the leading causes of serious complications in seniors, especially those with diabetes or circulation issues. As we age, circulation to our feet decreases, making them more susceptible to fungal infections, bacterial growth, and slow-healing wounds. Many seniors can't see or reach their feet properly, leading to neglect that can have devastating consequences. Here's the proper technique. Wash feet daily with warm, not hot, water and antibacterial soap. Pay special attention to between the toes where moisture and bacteria accumulate. Dry thoroughly, especially between toes, and inspect for any cuts, sores, or changes in color.
What are the warning signs people should watch for?
Look for redness, swelling, unusual odors, cuts that won't heal, or any changes in skin color. For diabetics, even minor foot problems can lead to serious infections that may require amputation. I had a patient, Robert, 72, who developed a small cut on his toe that he ignored. Because he wasn't washing and inspecting his feet daily, the infection spread and nearly cost him his leg. Now he follows a strict daily foot care routine and hasn't had problems since. Apply moisturizer after washing, but avoid putting it between toes where it can trap moisture. Wear clean socks daily and shoes that fit properly to prevent injuries.
All right, Dr. Mitchell.
This might sound like a silly question, but do seniors really need a how-to on washing their hands? I mean, most of us learn that right after learning how to tie our shoes.
The second critical area is your hands, but not just casual washing. I'm talking about thorough, medical-grade hand hygiene that becomes even more important as we age. Seniors touch more contaminated surfaces in healthcare settings, have weaker immune systems, and often take medications that further suppress immunity. Proper hand washing can prevent up to 80% of infections in older adults. The technique matters enormously. Wash with warm water and soap for at least 20 seconds. That's longer than most people realize. Scrub between fingers, under nails, and up to the wrists. Rinse thoroughly and dry with a clean towel.
When should seniors be especially vigilant about hand washing?
Always before eating, after using the bathroom, after touching surfaces in public places, before and after taking medications, and after any contact with other people. During cold and flu season, I recommend washing hands every time you enter your home. Carry alcohol-based hand sanitizer when soap isn't available, but remember that hand sanitizer doesn't remove all types of germs and isn't effective when hands are visibly dirty. Margaret, 68, started following a strict hand hygiene after a bout of food poisoning. She went from getting sick 4 to 5 times per year to staying healthy for over 2 years straight, just by improving her hand washing routine.
Okay, doctor. Now we're heading north, straight to the mouth. And I gotta ask, is it true what they say that what happens in your mouth doesn't stay in your mouth? Because if bad breath could kill, I think some of us would already be in trouble.
Well, Arthur, let's just say, if breath could carry bacteria the way rumors carry at church luncheons, we'd all be in ICU by now. The third area is oral hygiene, mouth, teeth, and gums. Poor oral health in seniors is directly linked to heart disease, stroke, pneumonia, and even dementia. Your mouth is literally a gateway for bacteria to enter your bloodstream. As we age, saliva production decreases, medications can cause dry mouth, and gum recession exposes more tooth surface to bacteria. Many seniors also have dental work that creates additional spaces for bacteria to hide. Daily oral care must include brushing teeth twice daily with fluoride toothpaste, flossing or using interdental cleaners, and rinsing with an antimicrobial mouthwash. Don't forget to clean your tongue, where bacteria love to accumulate.
What about seniors with dentures or dental appliances?
Dentures require even more attention. Remove and clean them daily with denture cleaner, not regular toothpaste, which can be too abrasive. Clean your gums and any remaining teeth, and always remove dentures at night to let your gums rest. Dental infections can quickly become systemic in seniors. I've seen patients develop life-threatening heart infections that started as simple gum disease. Frank, 74, had recurring pneumonia until we discovered bacteria from his mouth were being aspirated into his lungs. After implementing a strict oral hygiene routine, his pneumonia episode stopped completely.
All right, Dr. Mitchell. I feel like we're about to head into blush-worthy territory here. But hey, we're all adults, right? So let me just say what everyone's thinking. Do we really have to talk about down there? And I guess the answer is yes, especially after 60.
Yes, we really do. The fourth area is the genital and anal region. I know this is uncomfortable to discuss, but improper hygiene in these areas can lead to urinary tract infections, skin breakdown, and serious systemic infections in seniors. Aging affects this area significantly. Decreased mobility makes thorough cleaning difficult. Hormonal changes affect tissue health, and medications can alter normal bacterial balance. UTIs in seniors can quickly progress to kidney infections or sepsis. For women, always wipe front to back, use gentle, unscented products, and wash daily with warm water and mild soap. After menopause, the tissue becomes more fragile and prone to tears that can become infected. For men, daily washing prevents bacterial buildup that can cause UTIs or skin infections. Pay attention to any changes in discharge, odor, or discomfort. UTIs in seniors can cause confusion and falls, not just bladder symptoms. Linda, 69, kept getting recurring UTIs until we improved her daily hygiene routine and taught her proper wiping technique. She went from monthly infections to being infection-free for over a year.
Okay, Dr. Mitchell, now we're heading to the top. And I have to ask, do ears really need daily cleaning? Because if you're like me, the only time we thought about our ears was when the TV remote got too quiet.
The fifth area is your ears, both inside and outside. Ear infections in seniors can affect balance, cause falls, and even lead to serious complications like meningitis if bacteria spread. Age-related changes include increased wax production, drier ear canals, and often the use of hearing aids that can trap moisture and bacteria. Many seniors also have reduced sensation in their ears, making problems harder to detect early. Daily ear care includes gently washing the outer ears with a washcloth and soap, never inserting anything into the ear canal, and keeping ears dry after bathing. If you wear hearing aids, clean them daily according to manufacturer's instructions.
How should seniors safely clean inside their ears?
Never use cotton swabs inside the ear canal. They push wax deeper and can cause injury. If you have excess wax, use over-the-counter ear drops or see your doctor for professional cleaning. Watch for signs of infection. Pain, discharge, hearing changes, dizziness, or feeling of fullness. Ear infections can affect balance and contribute to falls, which are already a major risk for seniors. Here's a real case. My friend, George, 71, was having repeated falls until we discovered he had chronic ear infections affecting his balance. After implementing proper ear hygiene and treating the infections, his balance improved dramatically.
All right, Dr. Mitchell, let's bring it all together. For those of us who want a clear, simple routine, what does a healthy daily longevity hygiene plan actually look like from morning to night?
Great question, Arthur. Here's what I call the daily longevity hygiene protocol, and it's easier than most people think. In the morning, start by washing your hands thoroughly when you wake up. Then brush your teeth and rinse with an alcohol-free mouthwash. Wash your face and the outer parts of your ears. If you're showering, take a moment to inspect and wash your feet as well. During the day, keep your hands clean. Always wash before eating, after using the bathroom, and after touching anything in public, like door handles or shopping carts. If you wear dentures, make sure they're cleaned regularly too. In the evening, give your feet a proper wash and inspection again, especially if you skipped it in the morning. Clean your genital and anal areas gently but thoroughly. Brush your teeth, floss, clean your ears on the outside, and wash your hands one last time before bed. And then there are a few things to keep in mind weekly. Deep clean your hearing aids, check all of these areas for any unusual changes, moisturize your feet, and replace your toothbrush every month.
That sounds really doable. What kinds of products should older adults be using?
Stick to gentle, unscented soaps that won't dry out or irritate aging skin. For your hands, go with an antimicrobial hand soap. Use fluoride toothpaste, an alcohol-free mouthwash, and, if needed, an antifungal foot powder. And one big tip, avoid harsh scrubs or heavily scented products. As we get older, our skin becomes thinner and more sensitive, so go for gentle but thorough care. That's the key.
When we should seek medical help?
Seniors need to know when hygiene issues require medical attention. Don't ignore persistent odors, discharge, pain, or any area that doesn't respond to improved hygiene within a few days. Signs that require immediate medical attention include fever with any hygiene-related symptoms, spreading redness or streaking, severe pain, or confusion that might indicate a systemic infection. Regular checkups should include discussions about hygiene challenges. Many seniors are embarrassed to mention these issues, but your doctor needs to know if you're having difficulty maintaining proper hygiene.
That makes a lot of sense, and I know some of our viewers might be wondering, what if I can't manage all this on my own anymore? Whether it's due to arthritis, memory loss, or just limited mobility, what options do seniors have when daily hygiene becomes hard to do alone?
This is when family members or caregivers become crucial. If you can't perform these hygiene tasks independently, it's essential to get help rather than skip them. Adaptive tools can help. Long-handled sponges, shower chairs, grab bars, and electric toothbrushes can make hygiene more manageable for those with limited mobility. The key is maintaining dignity while ensuring safety. Professional caregivers are trained to provide hygiene assistance respectfully when family help isn't available.
How can seniors make this daily routine easier to maintain?
Create systems and routines that make hygiene automatic rather than something you have to remember. Keep supplies easily accessible, use checklists if needed, and link hygiene tasks to other daily habits. Set up your bathroom for success. Good lighting, non-slip mats, grab bars, and organized supplies. If bending is difficult, consider a shower chair or handheld shower head. For those with memory issues, family members can create visual reminders or even apps that prompt proper hygiene routines.
What about the psychological benefits of good hygiene?
Excellent question. Good hygiene doesn't just prevent infections. It boosts confidence, improves social interactions, and contributes to overall mental health. When you feel clean and fresh, you're more likely to engage with others and maintain an active lifestyle. Many of my patients report feeling more energetic and positive when they maintain strict hygiene routines. It's a form of self-care that pays dividends in both health and happiness.
Dr. Mitchell, what's your final message about hygiene and longevity?
At 58 and working with seniors daily, I can tell you that good hygiene is like life insurance. You pay the premium daily through consistent habits, and it protects you from devastating health events. These 5 body parts, feet, hands, mouth, genital/anal area, and ears, are your most vulnerable infection sites. Protecting them through daily hygiene can literally add years to your life and life to your years. Don't underestimate the power of simple, consistent hygiene. In an age of complex medical treatments, sometimes the most effective medicine is soap, water, and attention to detail.
That's incredibly practical and potentially life-saving advice. To our listeners, your daily hygiene routine is one of the most powerful tools you have for preventing infection and maintaining independence. These simple steps could save your life. Remember, taking care of these 5 body parts daily isn't vanity, it's survival. Make hygiene a non-negotiable part of your daily routine. We'll see you next time on Senior Strength Show, where we continue empowering you to live your longest, healthiest life possible.